So the question we get asked the most is, hey doc, what's a good pillow for me? And so before we even dive into the right pillow for you, we want to talk about the sleep position. So we go over this with our patients quite a bit, especially if you are waking up with any stiffness or any pain. We always evaluate the position that you're sleeping in because it does make a difference. So we spend a majority of our time sleeping. So if you're getting 6 to 8 hours a day, that's like a third of your day that you spend sleeping in one position. So it's really important that we're in a good position during that time, so we're not putting extra stress on different areas like the neck and the lower back. So one of the ways we encourage our patients to sleep is in the position laying flat on your back. So this is ideal for your spine, putting it on a good position, not putting so much pressure on your pressure points. So laying flat on your back, preferably with a pillow underneath your knees, kind of helps take pressure off that lower back. So that's a really good position that we try to encourage, but it's not easy for everybody to sleep on their back. So if you can sleep on your back, great. If not, another good position to sleep in is on your sides.
Well, another good position that we like to recommend in our patients is sleeping on their side. Now, typically when people sleep on their sides, they like to do what I call the Captain Morgan kick, where they kind of throw a leg up in front of the other one. If you do that, we typically recommend just putting a pillow right here at the base of that knee, just to keep that pelvis in alignment. Because typically when you kick that leg up, it tends to kind of rotate the pelvis a little bit, and sometimes that can irritate the low back. So, lying on your side, even if you don't do the Captain Morgan kick, we still ask to put that pillow between the knees, because that still keeps the pelvis kind of in that straight line and allows you to kind of get better sleep without putting any irritation on that low back.
And then the position that we really try to avoid our patients sleeping in is on their stomach. So the stomach sleeping is not ideal in the fact that it is putting pressure in the reverse of most of your curves of the spine. So you have curves, natural curves of the spine. So when you're sleeping on your stomach, you're actually putting pressure in the opposite direction. So it's not really ideal for the spine to be put in that position, especially for 6 to 8 hours at a time. But also one of the downfalls with the stomach sleeping is the neck. So when you're sleeping on your stomach, obviously you have to turn your neck one side so you can get some air. But I always like to tell people, if you are a stomach sleeper, imagine this. Imagine you're sitting at your desk at work and I told you can only sit with your head turned to the left for 8 hours. Your neck would be so uncomfortable, in such pain, but you don't realize it because you're sleeping and you think that it is supported. So that's the one downfall of sleeping on your stomach. And so we kind of can coach you through ways, if you are a stomach sleeper, to kind of transition into side sleeping. So we'll kind of go over some of those tips and tricks. So I like to put a barricade of pillows on your side. So if you're a stomach sleeper, the best way to transition is to become a side sleeper. And to do that, you start on your side with a bunch of pillows just on the front of your chest and your legs, so that if you do in the middle of the night start to habitually turn over on that stomach, those pillows are going to block you from going all the way over. So it's a good way to transition into side sleeping.
So let's transition a little bit from talking about sleeping pattern to what we're actually laying our heads on. So we typically like to recommend a pillow that is about 7 inches. Now, about 7 inches is about the length from the ear to the shoulder. So if you're laying on this shoulder facing towards your side, your head should not be one way or the other too much. So typically in a normal human average is about 7 inches of pillow thickness. So what we'll probably do is go through kind of our positioning for the pillows and kind of give you some tips and tricks to that as well.
And this is kind of where, when people ask us, hey doc, what's the best pillow? It honestly really, really depends. Again, on your sleep position, on the thickness of what he was talking about, that neck, the thickness of how much space you have between the ear and the shoulder. Everybody's so different that it's really hard for us to recommend one specific pillow. So it honestly is important for you to find one that works best for you. So we'll kind of go through what you should look for in a pillow, depending on the position that you're sleeping in. Because again, we don't want the pillow to be too big or too small, because it's going to put pressure and put your neck in a position that's going to be uncomfortable on one side versus the other. So now we're going to go through some of the sleeping positions and recommendations, tips and tricks for getting the best position for you. So we're gonna start with the first one. So if you are a back sleeper, it's really important that we find a pillow that allows your body to stay neutral. We want the spine to be neutral. So here's some things that we find a lot of people do. So they use more than one pillow. So let's just look at what that looks like. Good. So for Dalton, these two pillows are way too much for him. So you can see he is actually in flexion. So his neck is gonna be stressed in the back of the neck while he's sleeping all night. So ideally you want one pillow, okay, and you want it to start at the shoulders and then support your neck. So this is a perfect pillow for him. His neck is nice and neutral, and so he's not in a position that's going to aggravate his neck. Another tip for you if you are a back sleeper is to put a pillow underneath your knees. So go ahead and bend your knees. So just one pillow, two pillows, whatever works best for you. What that'll do is it'll just take a little bit of pressure off that lower back. So tips and tricks for if you are a back sleeper. So the next sleeping position we're going to talk about is if you are a side sleeper. So some tips and tricks for if you are a side sleeper is, of course, making sure that you have the correct pillow. So this is really vital that your pillow is not too big and it's not too small. So you can tell right now already Dalton is using two pillows and that is way too much for him. So you can see that his neck is kind of bending, so it's tilted upward. This is going to strain his neck throughout the night. But you can also tell if we get rid of all of the pillows and he had no pillow, his neck is bending down towards the mattress, and again, that's going to stress his neck at night. So what you want is a pillow that allows your neck to be neutral in a position for that nighttime. So this is the perfect pillow for Dalton. His spine is nice and neutral, and the only other thing I would add is a pillow between the knees. Good. So a pillow between the knees, when you lay on your side, your knees together are way smaller compared to your hips. So what the pillow does is that allows your knees and your hips to be at the same level, so you're not getting a lot of pressure in the pelvis and in that lower back. So pillow between the knees. All right, the next position we're going to talk about is stomach sleeping. Of course, this is not ideal, but we do know that it is a hard habit to break. So to make it better, here are some tips and tricks. So we automatically have a curvature in our lower back. So when we go on our stomachs and we're sleeping, gravity is just pulling that lower back even more into extension. So what we like to tell you is to put a pillow underneath your pelvis and your stomach, and what that'll do is it'll kind of put a little bit of pressure or take pressure off of the lower back when you're sleeping on your stomach. And of course, a pillow is just as important. But one tip and trick that we like to teach you, because we want you to get out of this sleeping habit, but it is a hard habit to break. So what I'm gonna have you do is I'm gonna have you go on your side for me, Dalton.
Which side?
Facing there. Take the pillow. And then what I always recommend is that if you are a stomach sleeper through and through, the best way to try to break that habit is to start on your side. So what I like to also tell patients is to take a pillow, and what you want to do is you just want to, build a wall of pillows on your stomach, because that'll do a couple things. So first, if you're a stomach sleeper, you like pressure on the chest and on the stomach. So if we go up belly side, flipping to laying on our back, we're totally exposed and it's gonna be really hard to fall asleep. So the pillows are, number one, going to be basically a secure blanket. It's going to put pressure on that chest like you're used to. But what it's also going to need to do is, if in the middle of the night, if your body just tends to want to roll to try and get in that stomach position, the pillows are going to stop you and you're not going to get all the way there. So that is my biggest tip and trick for you stomach sleepers that are trying to transition into sleeping on your side or your back.